This MediSpa Insider series is something that I do hope and intend to continue. We're going to bounce around to all different topics. And I like to call this series Know Before You Go. So my intent with these is really to give you most, if not all, of the information that's conveyed during a consult on whatever topic that I'm speaking about, without you actually being physically present for the consult. And then hopefully that would, especially if you're new to a treatment, help you understand some ideas about alternatives, if that's important, and even understand what questions you might go in with. Because ultimately, a consult is also about making recommendations that are based on your face, your anatomy, or your body part, or your particular concern. So it's impossible to do a program that's going to address everyone's question and tell you exactly what you need. But I do hope you find these very informational. I hope you find maybe they clear up some myths and misconceptions and give you some good questions to ask, and possibly even some ability to compare treatments a little more easily. Because one of the challenges in aesthetics and in regenerative medicine is there are so many options available today that it can be hard to know even what treatments to look for, or hard to know what questions to ask. Hard to get an idea if something is really going to be well suited to you. So again, I thank you for joining me. These will all be recorded, so you will have the opportunity in the future to watch it again if something's not clear, and they'll ultimately be on our website too for the future. You can also share those links with other people. So stick around till the end, because I will make a special offer for people who might be interested. But again, today's topic is all about Botox. I'm going to go into what I think are the most important points for you to consider, and really to get an understanding of how we make decisions regarding Botox. So just in case someone here doesn't know me, my name is Dr. Lisa Vuich. I'm the owner of Renew MediSpa and also the Renew MediSpa Training Institute. I opened Renew back in 2006. I am a clinical educator. I'm considered a master aesthetic trainer. I am board certified. I belong to a number of relevant organizations, and I'm also involved in some clinical research, which we'll go into in some future topics, but I'm not involved in any Botox research, so we'll skip that over right now. If you haven't been to Renew, we are located in Derry, New Hampshire. That's just over the Massachusetts border, up a couple towns. We specialize in non-surgical aesthetics. It's non-surgical for the face and body, and also in sexual wellness procedures for men and women, and things like bioidentical hormones and such. So that will certainly be some future topics coming up. So what do I mean by know before you go? There's really quite a bit that goes into the process of how we develop a plan for Botox for each person when they come in. Now, Botox is in a class of medications called neuromodulators. That means they have an effect on nerve signals. Now, we use the word Botox fairly loosely and fairly generically, but we'll talk about that. There are actually different brands, but in shorthand, we call it all Botox, short for botulinum toxin, or I might just use the term BT right now, because I want to try to explain that there's different brands and that may make a difference when you're actually having a treatment. We want to talk a little bit about what are the main target regions, the dose ranges. I'm only going to talk about the face and the neck. We don't do much with tox off the face and neck. How we select a starting dose for each region, what it means about having different brands and what those are and how they compare. What are the potential problems if you get a Botox injection, and what are the fixes for those problems if they occur? I'd like you to understand what you're paying for exactly, how best to prepare for your injection, what to expect afterwards, and what to do and not do in that post-treatment period, and also ideas for how to pay less. And even things non-Botox, what do you do about wrinkles if the nurse or physician or, injector says, sorry, that's not for Botox. So we'll be touching on all of those points. And I will take your questions more towards the end. So when we talk about a Botox consult, okay, what are we talking about? Well, you may have heard the term or heard it explained that there are different types of wrinkles, okay? Traditionally, we talk about static lines and dynamic lines. And the rule of thumb is that static lines, which are lines that are present even when your face is completely relaxed, someone would say, oh, Botox isn't going to work for those. In fact, they may improve somewhat over time when you do use Botox, but they're not the main target. The main target for our wrinkle relaxers or botulinum toxins is dynamic wrinkles. Those are lines on the face that are caused by repetitive facial expression. So think of the muscles in your face, which I'll show you shortly, continuing to make the same actions over and over and over again when we talk, when we think, when we dream, etc. And those repetitive muscle actions always in the same direction or similar directions causes some wear and tear on the collagen. And that wear and tear will ultimately surface potentially as a dynamic wrinkle. These are the most likely to respond to Botox, to neuromodulators or botulinum toxins, but not all dynamic lines can be targeted, okay? We can't relax any of the facial muscles we want to, or we'd have people looking like they had a stroke, correct? So primarily, Botox is used in the upper half of the face, although we do have some limited areas in the lower face where sometimes they can be useful, and even in the neck. So what are some of the key points? One is that botulinum toxin, I want to say BT, relaxes muscle temporarily. This is a relaxation. It is generally not a complete paralysis. So it is normal after a BT treatment to have a little bit of wiggle of movement, to have a little bit of ability to twitch, but you shouldn't be able to make the lines really deep with muscle movement if that area has been targeted with the toxin. It's very important to understand that these medications don't fill a line. They don't fill a dent or fill a fold. They fill nothing. They just relax the fine facial muscles that are making the line deeper. So that's really an important point. The dosing of these medications needs to be individualized, as it says here, and I'll tell you what we use, what things we look for, really to even start to begin thinking about what dose to use for you when you come in. And the best results are always going to be seen with consistent use over time, okay? If you do it on a regular basis, your result will keep getting better and better. The botulinum toxins work by blocking the signal from the nerves to the muscles. So if you're going to move a muscle either consciously or unconsciously, there's a signal called acetylcholine that goes from the nerve endings there to the muscle and then allows the muscle to contract and create the movement. These medications have been around for a very long time. The first FDA-approved therapeutic indication was back in 1989. And it's important to know that these cosmetic doses that we use, that I'm talking about tonight, are extremely safe. So you're going to sign a consent form, though, that lists many potential adverse possible effects that we really don't see with the cosmetic doses, maybe with medical or what we call medical therapeutic doses, like for spasticity of a muscle, when they're using hundreds of units, then it's going to be more likely to see some of those potential side effects if someone has essentially is a little bit unlucky to suffer a side effect. But the facial doses really don't spread to the rest of the body. So we don't worry about a lot of those with cosmetic dosing. And as it says here, the doses we use total, and I'm talking about for the whole appointment for a person, regardless of how many cosmetic areas we're treating, typically is in the 25 to 100 unit range, somewhere in there. The dose that could actually be really harmful if delivered systemically, meaning to the body in general, say it's spread, would actually be 2,500 to 3,000 units. So you can see there's a really large margin of safety. Another couple of important key points are that the dose you use is going to affect how well it works. When I'm speaking with clients at the medical spa, I explain this as the dose-effect relationship. So a lighter dose is going to work differently. It's going to have a different effect than a medium dose, and that will have potentially a different effect than a heavier dose. The dose will also affect duration very often. So once again, if you go with a dose in a muscle group that's too light, considering what we consider, that's likely to affect how long it lasts. So you may not get 3 months or 4 months or longer from that dose in that area. It may look great in the first handful of weeks, and then you may feel like it's totally gone. So if you get less than 3 to 4 months out of your toxin appointment, you have to consider those two things. Was the dose too light that I didn't get the effect I wanted? Was the dose too light that I didn't get the duration that I wanted? And if you adjust for that, you may have a better experience the next time. So here you see a cartoon of what the major facial and neck muscles are that we target. And I'm going to go through this from top to bottom. And again, you can always refer back to this at a future time if it's a bit much initially. The scalp that's marked there, that's called the frontalis muscle. That is the muscle that raises your eyebrows. And very often, horizontal lines there are, of course, a target for toxin medications. Then we move down to the muscle around the eye. On the side there, you can see that's the orbicularis oculi, and that's crow's feet, if you recall that term, those fine little lines on the outside. Up here with the orbicularis oculi, it actually pulls the tail of the brow down. So when we dose near the tail of the brow, you're going to get the opposite, which is a lift in the tail of the brow. So remember, whatever the normal muscle action is, the toxin is potentially going to produce exactly the opposite. So if your forehead raises your brows, then when it relaxes from a toxin injection, you can potentially lower your brows. The muscle around the eyes pulls down and in like a camera lens, right? So if we basically put this muscle to sleep a little bit with some botulinum toxin, the effect or result you're looking for is a lift and more of an open eye. Moving down to the nose, you see there under nose a muscle called the procerus. That's this muscle right in the center that pulls down. So when we tox dead center here, we expect a little bit of a lift and a softening of what we call the angry 11s. And then there's a pair of muscles to the side of that called the corrugators. And this whole complex, probably the most popular area for the toxins, will prevent you from making those angry 11s or those hatchet marks. So once the medication kicks in, you'll actually get a relaxation, which is a lift and a little bit of a separate. We can't really relax cheek muscles with toxin. So I'm often pointing this out to people who are getting toxin around their eyes and explaining to them the very lowest wrinkles right down here. When you smile, that muscle is still going to contract. That's your zygomatic on the diagram. It's still going to contract and push skin up. So this lower line is often not one that we can target with our cosmetic toxins. Moving down around the mouth, the orbicularis oris muscle. Some people will do a little bit of toxin above and below to essentially stop them from pursing the lips and making those lines deeper. Again, it's not the same as having laser resurfacing. It's not the same as filling lines. It's just relaxing the muscle that's making the lines deeper. A common term for that injection is called a lip flip. If you look down on the neck, you see that the platysma muscles are marked there, or they're showing you at least one of them there up front. And I'll show you on another diagram, which gives the doses really what that targets. So the platysma muscles can pop forward and give people these neck bands that kind of seem, and it's more prominent in some people, but those strap type looking muscles that are in the front of the neck, if those are popping forward and really active, those are called platysmal bands, and we'll sometimes relax those with toxin too. Interestingly, the platysmal bands are also pulling down in your jawline. So if we want a little bit of a lift in the jawline area, we may be treating these muscles in the neck, which naturally pull down and forward. So they're neck flexors, essentially. I think I've run through most of them. There are tiny little nasalis lines on the nose. Some people will call those bunny lines, and they have those prominent little ridgy lines. That can be targeted specifically. And there's also a muscle that starts here, or that's sort of attaches here by the corner of the nose. And if someone has a very gummy smile where they show a lot of their gums, if we put a little toxin in the corner of the nose region, we can reduce the appearance of that gummy smile. So again, we're picking muscles and understanding the action of the muscle and understanding that the toxin is going to relax the muscle. So you're going to get the opposite of what the muscle normally does until it wears off. So here you see on more of a human face, along with some dose ranges, those target areas, those major target areas. And I'll give you a couple minutes here just to kind of look at that. One I didn't talk about yet is the masseters. Those are on the sides of their face in front of the ear. And some people really grind and tighten their jaw a lot. They may get very squared off here, and they may get pain from grinding. So we sometimes target that. Most common dose for the masseters is 25 units per side. So you see there, it says 15 to 50. So look closely at these areas and notice the range in doses. So the question arises, of course, well, if there's a range, then how do we decide for you what the dose is going to be that day? There are different levels, and there's no one right answer, as I said, for everyone. So first of all, men may require higher doses than women. They may have basically a larger muscle in a given area, particularly between the brows. I'll show you that in a second. We sometimes do lower end doses intentionally. You might have heard the term baby tox. That's often what we use when we're doing very light doses or sort of half doses, perhaps in a woman who's in her 20s or her 30s, hasn't really developed deep lines yet. They're getting ahead of it and they want to do tox preventatively. So a common term for that is baby tox. You may come across a term called microtox. That's actually something different. Microtox is taking a given number of units of the tox and putting it in actually more saline, actually diluting it, if you will, making it more watery and spreading it in a superficial, close to the surface, large area when you're trying to get sort of an overall skin textural effect. It's a tricky thing to do. It requires a lot of units. It tends to be quite expensive to treat textural things that way. So most people, if they're looking for textural changes, rather than doing microtox over and over again, they will do something else. Like we're going to talk about some procedures like laser resurfacing, and I'll show you some smoothing thread procedures. Those will probably be more cost effective for lines and wrinkles that can't be addressed by traditional Botox dosing, which is basically what you see in this diagram. The typical areas and the typical number of units. We're usually falling somewhere in between there. So selecting a starting dose. First of all, I look at anatomically, what is the size of the area? How big is that muscle belly? So this is where your injector may ask you to make a face, in part to see what it looks like when you maximally contract that muscle and how big it actually is. Anatomic size is important because it's going to dictate whether we go for the medium to higher end dose or whether we actually go for a lower end dose. So if we look at this comparatively, the woman on the left and the man on the right, you may actually notice that her muscle is smaller, a little more delicate looking, and his is perhaps stronger, especially in between the brows. Remember, I mentioned that muscle called procerus, which is right here in the middle. He has a much stronger procerus muscle than the woman on the left. I hope that's evident. The next thing we consider, as I mentioned just one slide ago, is the age of the person. So if we're treating someone who's younger, someone who doesn't have a lot of established lines, we may treat that one way versus someone who's in their 50s or 60s. We're going to go for a different dose. And then as people get older, if someone comes in and they're already in their 70s, we may again drop the dose, especially if they haven't done toxin at all or haven't done it recently, because they may actually react even stronger because they've lost some muscle mass. So one way or another, with age or physical appearance or past history of dosing, we're trying to figure out how much muscle bulk are we trying to treat and pick a dose that's going to get this person a reasonable duration of effect. Because very few people want to be coming back every 2 months for this type of injection. They want some longevity out of their injection. We take into account if you have an upcoming social event. Why? Well, if it's coming up in a handful of days and you want your tox to be completely kicked in, we may have to reach for a faster acting product. And there is some difference in terms of onset of action amongst the separate brands. Also, if you have an upcoming social event, we may be concerned about treating an area you've never treated before. So if you haven't done forehead before, for example, right before a big event is not a great time to do a new area because we want to be sure that you're going to like what it looks like once the effect happens. So do try to come in at least once before a big event and not too close to it so that you can experience different doses and know for sure what works best for you. Your personal preference is obviously a consideration. You may have tried different brands before. You may, in fact, have found out that one just seems to work better than another brand for you. It may last longer. It may kick in faster. You may feel it just looks better with a comparable dose. So your own experience is obviously important. Most people who come to Renew for the first time don't know really what brand they've had before and usually don't know how many units, or if they know how many units they've had before, they don't know, of course, exactly how it was placed. They don't know how many of those units went between the brows versus went to the forehead versus went around the eyes. So it doesn't help us for you to say, well, I had 5 injections, because that doesn't tell us the number of units or the brand or exactly which muscle they were placed in. So if you can, it's not a bad idea if you're going to a new injector to call the place you went to before and at least find out how many units you got. At least then we know we're in the ballpark. We might not know exactly how it's placed, but we know sort of the total dose, and then we can choose a distribution that makes sense. And you don't have to tell them, I'm going somewhere else, give me my dose. You could call and you could say, for example, I'm thinking of coming back in to repeat my tox. Can you tell me how many units I had last time? Oh, great. What brand was that I had last time? Okay, I'll call you when I'm ready. I need to go check my schedule, right? Then you have the information. Hopefully they've given it to you, and you at least know brand and total units. So that's interesting. If you can't get it, it's not a big deal. We're always going to be able to start somewhere. It's just an interesting piece of information. So here you see the 4 brands that are currently available. And again, here's where things get confusing, because as you see, the first brand that was FDA approved in aesthetics was actually called Botox, or Botox Cosmetic. It's a 100-unit vial you see there on the left. It's been used medically since the 70s, but it certainly had at least one of its cosmetic indications by 2002. The next one to hit the cosmetic market officially was Dysport. That's the one we've been using the most of, actually, in the past handful of years. So that came out around 2009. Xeomin was the third into the market in about 2011. And more recently, one called Jeuveau, which hit the market in 2019. Jeuveau goes by the marketing hashtag #NewTox. If you may have seen an ad about #NewTox, they were referring to Jeuveau. Now, what's very exciting is there's actually a 5th toxin, which we expect is going to hit the market hopefully by the end of this year. Things got delayed due to COVID, of course, so it's been coming slowly. But the studies of this one, daxibotulinum toxin, showed that most people actually got 6 months, some people even 7 months out of their dosing in the studies. So that's exciting. And interestingly, if they did get a minor side effect or unwanted effect, it didn't last any longer than people who were treated with a competitive or, a competitive brand. So it wasn't a case of, well, you got double the duration, but the side effect went double. It didn't quite pan out that way. So that's reassuring. We don't know what they're going to actually call this tox. Okay, daxibotulinum toxin A is the name of the chemical, but that's not the marketing name. That's not what you're going to see, or that's not the name people are going to use. So it remains to be seen what trade name they're going to give it. It gets very confusing. I'm going to try to sort of simplify it, this is how I try to simplify it for my clients. All of the brands, the ones I just went over, and daxibotulinum toxin A, which is coming out, right? They all essentially have the same active ingredient. All right. It is the same active ingredient. Okay. It's botulinum toxin type A, regardless of the brand. That is the class of the ingredient. What varies is the manufacturing process. So there are subtle differences. What gets confusing is that the units technically are not interchangeable. So, put another way, you cannot say that one unit of Xeomin will work for you exactly the same as one unit of Allergan Botox, or exactly the same as one unit of Jeuveau or one unit of Daxi. It's not an exact comparison. And that's as simplified as I can make it. Now, they're close, but there are going to be subtle differences in the experience and subtle differences in the effect. And as I mentioned, there are going to be differences potentially in how long it lasts. Daxi may last the longest of all of then 5 of them once it's on the market. So that will remain to be seen, but the studies did look promising. We do know that the amount of the active ingredient in the vial of one brand is not exactly the same as is in the vial of another. Again, even though they both say 100 units, the units are not interchangeable. They're what we call proprietary. So, it's not unit for unit. Try to just kind of keep that in your mind, that the dose of one and another there's going to be some subtle variation, and you may want to try different ones and see if you have a preference. You don't have to. You can always stick to what you know. I'm just saying it's worth experimenting if there's something like that. Now, some of the products have stabilizing proteins in them. Again, that's there because that, again, is a difference in manufacturing process. So some of them, for example, contain a very small amount of what we call purified human albumin. All right, it's a stabilizing protein. A stabilizing protein does not give you the Botox effect. It doesn't do anything for relaxing the muscle. It's there to stabilize. So Botox, Allergan brand Botox Cosmetic, has the most human albumin in it, 0.5 milligrams in a vial. And Jeuveau also, I believe, has the same. Dysport has half of that. There's no albumin in Xeomin, and there's also no albumin in the daxibotulinum toxin that's coming out. So that's a little different there. It doesn't contain any human albumin. So I hope I didn't really confuse you, except to just kind of drive that point home. Units are not interchangeable. We will try to walk you through that when you come in and we're trying to decide on dosing. But it's not, they're very similar, but they're not exactly the same. So how do we decide what's best for you? As I said, at some point, you may just need to try what I call a comparable dose of a competitive brand, something different than what you're used to. How will you know what a comparable dose is? We've got to help you with that. Okay, because again, the units are not interchangeable. So if we know you've been getting Xeomin 50 units and we want to try Daxi, we're going to pick a dose of Daxi based on what we expect would be similar in effect to 50 of Xeomin. And then ultimately, we're going to have to try it, and you're going to have to tell us if you prefer it. Remember that if you're going to compare effect, if you're going to compare results, it's very important as you're switching around different brands to have a consistent injector. Okay, because if you're changing brands and you're changing injectors at the same time, if you're bouncing around, you really don't know what you're comparing. There's too many variables if you're varying the injection site that you're going to. So try to stay in a stable place, experiment with different brands with the same injector. And then if you feel like you found something that works the best for you, then you can ask for that one by name. Remember, too, if it sounds too good to be true in terms of a deal or a sale somewhere, look at it with a grain of salt. It probably is. So we have to weigh the pros and cons of shopping sales. Let's move into what things can go wrong. I call them pitfalls because there are some common pitfalls. I'm going to go over those with you so you really have an understanding about what they are and what you can do about them, if anything. The first pitfall is expecting botulinum toxin, cosmetic, can do something it's not designed to do. All right. We talked about the static lines, the dynamic lines. Sometimes there's a misunderstanding because someone thinks a line is going to get better with toxin, and it's not a line that Botox can make better, like that lower crow's foot line. So being prepared for that, understanding that once the muscle completely relaxes, that's not a guarantee of skin that is smooth as a baby's bottom. Okay. So be realistic. Number two, not anticipating what will happen when the treated muscle relaxes. All right. I'll give you an example of this. Most people who come in and want their brows to be higher will ask me to inject their forehead. The forehead is the muscle that lifts your brows. When I inject your forehead and I relax the muscle that lifts the brows can drop. Okay. It's the opposite of what you're really looking for. All right. If we want the brows to raise, we have to inject the muscle that's pulling down, and that's down here. That's not the forehead. Another pitfall is not treating the full area of the muscle. Okay. Treating it unevenly or not putting enough toxin into it. If you don't deliver the tox correctly, it may not work as well. And again, that's a reason not to jump around too much with injectors. As I've mentioned before, underdosing is a big problem for you. If you're not getting the effect that you want, it may be because not enough units were used for your metabolism or for the size of your muscle. If you get too much relaxation, okay, if the dose is too high, that's a pitfall because you may look weird. You may not be able to raise your eyebrows. If you underdose, it may not work well, as I said, or it might seem okay initially, and then 6 weeks later, the effect is gone. So remember, dose effect, dose duration. The most dreaded unwanted effect is for some muscle nearby to relax that you don't want to relax, such as the eyelid droop, the actual falling of the eyelid. That's actually quite rare, but it happens, every once in a great while, even to a seasoned injector. That's definitely certainly a pitfall. And there is fortunately a prescription drop we can give people that will help undo that while they're waiting for their tox to wear off. But we don't need to go into depth on that. Chasing sales, Botox parties, Groupon deals. Again, be really careful. I can't think of a person who came to me who said they went to a Groupon and it was a fabulous experience and they loved it. All right. Pretty much 100% of the time, someone comes into me, says, I went to a Groupon, it sounded like a great deal, and then it didn't work. Okay, why didn't it work? Well, it didn't work maybe because of bad technique. It didn't work maybe because of bad product. It didn't work maybe because you didn't get the number of units that you needed, or you didn't get the number of units that they said you were getting. So that happens a lot. What about crazy brows? Definitely a pitfall. As I mentioned earlier, if someone gets brows that look evil, like in this picture of this man on the left, this is technically called the Mephisto effect. Most people don't want to look like that. Some people call it Spock brows. Most people, if they got eyebrows like this, would assume they got too much tox in their forehead. Remember, the action of the muscle is to lift. So if you have crazy peaked brows, what it means is you didn't get enough tox above where the brow is peaking. So there was not enough effect on the side. So the thing to do, if that pitfall occurs, is to come in and have an additional unit or two right up where you're getting the peaking, and that will tame that down and even things up. So again, the forehead is the trickiest area. It's important that we as injectors keep a detailed treatment map of what dose we used, where we place the units, so we can deliver to you a very consistent experience. Forehead lines also get tricky because the muscle is uneven. If you look at the picture of this woman and this man, they both seem to actually have perhaps a stronger muscle on their right side, which is going to be on your left on the screen, and a weaker left-sided muscle. So again, just something we need to take into account when we deliver those units to the forehead if we're going to treat that area. It's very common with forehead dosing because we really don't want to drop someone's brows that we will start light. And we might need to add a few units or add an additional dose in 10 to 14 days. This is part of that discovery period when we're determining what's the product brand and what's the dose and what's the distribution or the actual diagram of the placement that's going to give you the ideal result that you want. It's not a one fits all scenario, as you can tell here. If you do want to treat your forehead, most of the time we also need to treat this muscle in between. I mentioned that's the glabellar complex, and that's because these two muscle groups are in a tug of war. So if we relax the muscle that lifts, right, the forehead, if we relax that one and we don't relax the muscle group that pulls down, you may get that angry owl drop in the center because this muscle can engage without any opposition because you relaxed the forehead. So talk to your injector about that. If you're possibly thinking of treating only your forehead and not between your brows, because that may throw things off, and you may want to book a follow-up appointment in 2 weeks to make sure that worked out for you, that you don't feel like you have an unusual brow shape. This is a very common scenario we see if you look at this picture of what I've called heavy lids. These lids are already low. It's in part because of course, loss of collagen, and the brow is sitting lower. This is what we call brow ptosis or brow drooping. This person is basically relying on that lift of the brow to keep this skin up and not obstructing their field of vision. So if we take someone who looks like this and then we relax their forehead with tox, we're very likely to get into trouble because that skin is probably going to drop lower, at least for a handful of weeks, if not longer. And that may not be the look that you're going for if you've already got those heavy lids. So that's an unwanted side effect of relaxation of the forehead muscle, of the lifting muscle. This is different than a drooping eyelid. It often gets confused with that. A drooping eyelid is an actual complication. It's something we don't expect to happen in a neighboring muscle group, not a piece of skin. So you see the comparison here. I think it will be very evident what the difference is. If you look at the woman on your left, the eye on the left shows a little bit less upper eyelid. Her brows are very close to the same position, but maybe that right brow is lower. Her right side, which is on your left, her right side is her lower side. Her left side is her higher side. That eye looks a little more open. An actual lid droop looks like the cartoon on the right, where the lid is down. It's covering more of the iris than the normal eye on the right. That's definitely what we don't want. So you may want to look the next time you're looking in a mirror and see if you have, without toxin, a high side and a low side. If I see someone has that and it's more obvious asymmetry than average, I will point it out to them before I inject so that it's very clear that they understand that that existed before, that I didn't cause it. And sometimes we're placing the toxin away to try to get the lower side higher and leave the higher side where it is, so we get a little more asymmetrical look. We can't make it perfect. Nobody's perfectly symmetrical, but sometimes we can make it look more balanced. Now, consistent use, so repeating your tox dosing over time, helps you get a better result, a smoother result overall. So here you see some photo progressions of a few people at baseline, and then after their first, what's called their first cycle or first treatment of toxin, and then what their area looked like. This is the area between the brows specifically, what it looked like week 4 after their second cycle. And if you blow this picture up and you look closely, you'll notice that when you go from the left to the right, things look progressively smoother. It's not that the dose changed, it's that the skin's had some time to rebound now. It's had a prolonged period of time when the muscle wasn't contracting and creating those deep lines, so it's been able to get smoother. So if you're consistent and you repeat your tox, when it wears off, you'll notice over time that the effect is better and better to a point. This is what I call beyond Botox. Okay. Remember, I mentioned that one pitfall is expecting the tox to do something it can't. These lines, not that you couldn't do a few units around the lip and maybe over time reduce those pursing lines, but most of these lines are something that if you really want smoothness, you're going to have to stimulate collagen in another way. And I'm not going to go really deep into this because it's not the topic tonight, but just so you're aware, lines like this, very often we're considering laser skin resurfacing because we need something that's going to make collagen in order to smooth that skin. We may be considering microneedling, which is also a collagen stimulating procedure. We may consider something called PDO Smoothing Threads. I'll show you those in a second. Those can be very effective for lines like this. Or we may, because these can all be done in combination or alternating over time, we may do something called platelet-rich plasma injection. That's when we get some of your own platelets from a simple blood draw out of that blood specimen, and we then inject them into an area where we want collagen to form. We can use the platelet-rich plasma or PRP with microneedling, with laser skin resurfacing, with PDO smoothing threads. All right. It's another option for collagen stimulation. So here you see a schematic actually also of dermal fillers. Now, dermal fillers are actually plumping the lines. Okay. They're actually restoring, in most cases, a compound called hyaluronic acid, or HA for short. So when we use dermal filler to smooth out a line, we're basically injecting a form of hyaluronic acid, which has already been lost due to the aging process, but it is something that your skin is used to having, and it helps you retain more moisture. One of the most popular HA fillers that we use these days is called RHA. RHA has hyaluronic acid in it that looks very natural to the immune system and simply replaces that lost hyaluronic acid and will plump the skin and smooth out some of your lines. The nice thing about filler versus tox is you do get instant gratification. You can treat areas that you cannot treat with tox, of course. They do gradually resolve, although the RHA has good 15-month data, which means that at 15 months, most patients still had some correction. Even HA fillers do stimulate some collagen. Even just placing the filler in with the needle or the microcannula is a collagen stimulation. You're always going to get some collagen stimulation from a filler. It just may vary how much you get. The fillers can be used in most of the same areas as botulinum toxin, except for one danger zone between your brows. So I don't use it there. I'll let you know why. And again, fillers can be combined with other modalities, smoothing threads, PRP, laser. The most impressive facial rejuvenations that we do over time are in people who do some of this and some of that, some fillers, some tox, some lasers, some threads, some microneedling. I'm not saying all at once in 3 months, but over time, according to the recommendations of the provider, if you use them in combination, you're going to get a better look and a better result than if you just tried to take one modality, one treatment, and beat it to death. Okay? PDO smoothing threads are tiny little threads. I took a picture of one smoothing thread and put it next to a ballpoint pen. So I think if you squint, you can just about see how thin that thread is. They are very tiny. They're loaded on these little tiny thin needles, or in some case cannulas, meaning dull metal pieces. They do dissolve over the course of 3 to 4 months, but they are local potent collagen stimulators. So while they're there until they dissolve, wherever I place them, you're going to get collagen build. So they can actually be sometimes even a little more cost effective than doing filler. But again, you don't get instant gratification. So we're usually doing these things in combination. And again, they can be combined with PRP. The downtime with smoothing threads, and you see some patterns there, how we might crosshatch them or place them in the face or neck. The downtime is the area is going to be puffy. And there's lots of times there can be a pinky smudge of a bruise or a little blue dot here and there. So there is a little downtime with these, but they can be very effective and they can treat lines that tox and filler cannot treat. Here you see a cartoon of how that works. You've got that thread loaded on that tiny thin needle or cannula. It's got a little hub so we can hold on to it. Once we introduce it into the deep dermis or just below that, and we twist and remove the metal, the thread stays behind. And the thread, as I said, is that localized potent collagen stimulation. And here you see various areas that I've placed these threads where we also might use tox. All right. But say we have the scenario I mentioned where someone has forehead lines, and if we treat their forehead with tox, their brow drops too much. Well, we might do what's in the picture in the upper right. I might, after numbing them up, that's why you can see maybe the skin's a little white. I put some little lidocaine with epinephrine, and then I'm introducing these smoothing threads right under those wrinkles that we want to smooth out. And then I remove the metal and the threads stay behind. Top left on your screen, that's that glabellar complex. Sometimes people do tox in that area and their lines just don't smooth out enough or are not smoothing out quickly enough for their liking. So I do not do filler in this area because there are blood vessels here that communicate with the back of your eye. And it is possible that if filler is placed in this area, it can get into one of those vessels and result in blindness. So I will not use filler in that area, but I will, as you see, numb it up, blanch out the skin the way you see it there, and then introduce a bunch of collagen stimulating threads. The same can be done for the necklace lines. It can also be done lower right there. You see it being done in this submental area to try to thicken up and make that skin a little more tight. All right. So smoothing threads are generally less expensive, at least per appointment, than filler. It's not uncommon to pay, say, $200 to $400 or maybe even up to $675 for the eye threads. But once you get the effect, once you get the collagen will outlive filler. Okay. So it may take you multiple sessions, but once you get there, the maintenance is easy with PDO smoothing threads. And again, we use numbing to make it comfortable, and they do gradually resolve. The look with PDO threads will always be very natural because it is just a collagen stimulator. It's not plumping or relaxing anything significantly. So how do you pay less? I mean, that's important too. I'm sure you've looked at different medical spas or medical offices, seen different pricing. It varies. It's important to understand that you're not just paying for what is in the syringe. Okay. You are paying also for the expertise of the injector and for, basically their support afterwards, as well in terms of managing expectations and deciding on dosing and all that other stuff. But there are some ways that you can pay less. First of all, there are manufacturer rebates often or usually, sometimes every visit. These are often in the form of a points program or a coupon that the company offers on a recurring basis. And with something like this, you can save anywhere from $20 to $50 per visit, regardless of what office you go to, as long as they log in electronically on your end and give you credit for your injection. So your injector or their office team member needs to do their electronic part to actually get you these points and to help you redeem these points, but they're generally out there. Your provider, and we at Renew certainly offer loyalty rewards. So your provider may do this as well. It may be in the form of a membership, for example, which we have. So at Renew, we have 3 membership levels. One is $99, another is $199, and $299 a month. This is an automatic withdrawal, if you will, that you set up into your Renew account. Now, all of that money is yours to spend on your products, your services, laser, filler, skincare, body treatment, skin tightening, whatever. We don't retain any of that as a fee. You're simply selecting the amount you want to put aside every month to let grow in your kitty. And then when you're ready to have something done, you're drawing from that. Because you're doing that on a recurring basis, we give you discounts based on the level you've chosen, either 5, 10, or 15% off everything you purchase or every treatment that you book. So how does this pan out? If your toxin is normally $15 a unit and you're getting a 15% discount as a routine member, that means you're really paying $12.75 a unit. So that's before the manufacturer 50 off, et cetera. That all comes on top. Now at Renew, we do allow new clients to save 15% for their very first treatment. So you could take advantage of that. And again, just pay $12.75 in this scenario, or even up to 20% savings if you do a consult with one of our consultants at Renew, which basically just means you sit down and they let you know about the different services that we perform, and they take some pictures that are baseline, which I can review, and we tell you, well, for the most ideal rejuvenation plan or to address your specific concerns, here's a schematic, here's a list of things you might consider based on your desires, your priorities, your budget, your preferences, your past history of what you've done, what's failed, what's done well. Again, that's why we call it a customized consult, because we're trying to give you a roadmap or an idea of what would be best for you. So when you do that type of a consult with it, most people do it once, you have a one-time 20% savings that you can apply to something. Currently, we also offer to our members something called Tox Club, which is a year-round option for them where they can always at any time buy 100 units for $999. So we call that a pre-buy. So you basically buy 100 units and use them as you go. And when you run out, you buy 100 units again. So you're working off a pack all the time. And you do that separate from your membership, but you can do it anytime. So that's as friendly as we can make it. I know lots of spas are offering some form of recurring membership or some sort of scenario like that. So it's worth asking, if you're not in our area, what ways you might be rewarded for your loyalty over time. Now, of course, our medical record tracks how many units you've used, how many you have left. You don't have to remember that. And again, it's a year-round benefit for anyone at any of those 3 membership levels. So that's considered a member's benefit. When you're preparing for your appointment, you want to select your provider very carefully. Again, a stable site, a place you can go back to if you're going to have, if you might have a problem or a question. Your injector should be someone who's readily available. Okay, somewhere stable. Ideally, not someone who, goes to a salon once every other month on the 3rd Tuesday. Okay, it's going to be harder to track that person down if you have a question or a problem. The most common dose range for the upper face, remember, is going to vary, but the most common dose range, just to give you a ballpark, is 20 to 50 units divided into usually 2 or 3 areas. Okay. So somewhere in, I gave you this diagram again, somewhere in there, most people, when they're coming in, will be using between 20 and 50 units. It's rare to have someone under 20, but occasionally someone might be up to 90, especially if they're treating their masseters or their neck too, or we're treating, every possible area, the numbers can add up. If you're preparing for an appointment, lastly, you want to avoid things that are going to make you bruise. And I've listed some of the major ones there. Aspirin, especially, an aspirin effect lasts for weeks. So if you're on aspirin and you can avoid it, if you're not on it for medical reasons, that's ideal. Motrin type products like naproxen, naproxen, Aleve, all of that, Anaprox, those at least for several weeks, honestly. But again, if you can't avoid taking them, you just need to understand that you're going to be more likely to bruise. You can get tox injections even if you're on blood thinners like Coumadin, Plavix, etc. Again, we do a lot of, compression, a lot of holding. We're trying to minimize bruising, but at the end of the day, someone who's on a blood thinner has a higher risk of bruising, but it's not a contraindication. Post-procedure, there are a lot of myths and misconceptions. The main post-procedure precautions are here, though. You want to avoid rubbing the treated area that day. You want to avoid compressing the treated area on that day, ideally. So if you've had your forehead or between your brows treated, we don't want you putting on a hat or a helmet that's going to press on here, because that's akin to rubbing the area we just placed the toxin. You can just use normal facial expressions. You don't have to go out of your way to actively exercise the muscle. The toxin is going to work regardless of whether you do face exercises or don't do face exercises. You can certainly use a cold pack or a cold compress on the area afterwards, as long as you're not rubbing. That's not a problem. In general, you want to allow about 2 weeks for the effect to settle in. Some of the toxins will work more quickly than others. To date, Dysport for us has been the one that kicks in the quickest, very consistently. It also has happened to be the one of the 4 available that has the highest amount of active toxin per vial. So it remains to be seen how quickly Daxi kicks in, but I think it's going to be actually pretty similar to the Dysport. So we'll see how that pans out. But looking at the studies, it looks like it is going to be a faster onset of action product than some of the others. And finally, what's at the top, ideally make your next appointment before you leave the office or spa. Again, if you're consistent about your dosing, you're going to get a better result over time. And so making that appointment acts as a reminder. So that's really a good way to keep yourself on track. And certainly ask questions if you're not getting to where you wish you were with the tox. You probably need to incorporate one of those other treatments that I listed: smoothing threads, laser resurfacing, platelet-rich plasma, hyaluronic acid fillers, very often used for fine lines. We like RHA2, especially in stubborn fine lines around the mouth, in the corners of the mouth, sides of the face, that sort of thing. It's really a beautiful product there. So finally, some of other random FAQs or frequently asked questions. Are there any long-term negative effects of cosmetic Botox? The answer: clinical experience dates back to the 1970s and has not identified any significant concerns. So you can be really pretty confident you're going to do fine. Another common question is, what if I am pregnant or trying to become pregnant? Or what if I did become pregnant and I didn't know and I got tox done? The answer: we don't treat pregnant patients. We don't even really like treating breastfeeding women just because, okay? There isn't a physical way that we expect that cosmetically placed tox in the face is going to get to the fetus or the breast or anything like that. We don't want to take the chance that perhaps a woman will have an issue with a labor, a delivery, with a baby, and then be able to go back in her head and say, oh, what if it was that Botox I got, and blame herself. So we'd rather just not even do it. All right. Having said that, there have been plenty of women over the years who got tox, didn't know they were pregnant, and their babies did fine. So it's not something you want to panic about if it happens. We just don't go for it if we know about it. How long it will take to work? I think I've sort of answered that. It's variable depending on the brand, the dose, also your own metabolism. Ideally, we tell you, give it a couple weeks. By then, it's generally full effect. We usually don't add more for at least 10 days. So be a little patient with it because it may look great at 2 weeks, even if it didn't look great at day 5. Do I have to use the same brand every time? As you see, I've presented that, not at all. However, we want to make sure we're comparing apples to apples, and we can help you through that if you want to try different things. Every once in a while, someone will get a headache from a tox injection. Is that normal? Yes, it's one of the most common side effects. It doesn't last. You can treat it with Tylenol. It doesn't happen every time. It seems to be sort of a random thing, maybe 10% of the time. So if it happens, don't be too concerned. And I believe I addressed this one. I got poked 5 times. Does that tell you how much I got before? The answer is no. Different doctors, different nurses add different amounts of saline to the vial. And depending on how many milliliters of saline you add, that's going to impact how many pokes and the distribution and all these things that you don't need to be worrying about. So the number of injections and the placement of the injections doesn't tell us how many units you had. So I hope this has been really helpful. Again, my name is Dr. Lisa Vuich. You see here pictures of my other injectors, Beth Wagner, Joanna Byam, Heather Dozwa, our newest nurse practitioner, and also Victor Peña-Doval has now completed his RN training. He was working for us as a medical assistant. He has now become an RN and is joining our injectors panel. I want to thank you for getting through this hour with me. I hope I've answered a bunch of questions. I hope I've given you some options for anti-aging that makes sense. Everything I've talked about here is something we're experts at Renew, and we've been very proud of these awards that we've been winning pretty consistently. If you are interested, as a thank you for people who watch this meeting, webinar, whatever you want to call it, we are doing a limited time promotion where you can buy 50 units for $599, just about $10 a unit. So if you're interested in that, just go to our website, www.renewmedispa.com. You can either send us an email or you can open the live chat box and you can say, send me the link to that promotion, because it's not going to be up on our specials page or anything, because we're not putting this there to the general population. It's only for a limited period of time for people who watch this video. So again, open a message in the chat box there on our website, do an email through the website, or of course, you can call during the week as well. If you want to talk to a human, that's fine as well. And they can send you the link to your phone if you want to take advantage. If you're already a member at Renew, remember, you can do the Tox Club, 100 units for $9.99. That's a little better deal. But that's pretty much it. I hope it's all been helpful information.